The topic of this teaching video is macular hole. Macular hole is something that typically occurs in the elderly, and it causes loss of central vision, reading vision. It is painless, and it can occur spontaneously without any trauma, although occasionally trauma also causes it. To understand a macular hole, it's a good idea to think about the anatomy of the eye. Inside the eye, lining the back, is the retina. This is neural tissue. It's actually a type of brain tissue that's connected to the brain by this nerve. And right in the center is a place called the macula. The light is focused onto the macula, and that's where the finest vision is done, the reading and central vision, color vision. And the basis of a macular hole starts with the interaction of the vitreous gel that fills the eye and the retina. When a person is young, the vitreous gel is stuck to the retina firmly. But with aging, the vitreous begins to liquefy and shrink and pull away, and sometimes there is traction, and when it pulls away, it tugs and pulls a small hole right in the center. That's one of the places where the gel is most firmly attached. When that occurs, there is no pain, but the patient loses a central spot of vision. They may complain of losing a few letters in the center of a word while reading, and when the patient comes in and is examined, it can be seen at the examining lamp and also on specialized testing where scans are done of the retina, and pictures are taken sometimes with dye injected into the arm so that one can see certain changes as the dye circulates through the retina. The treatment for a macular hole is an operation. This operation involves making 3 small holes in the white part of the eye, several millimeters behind where the clear meets the white, and then using a light, an infusion line, and a cutter to remove this jelly and replace it with a bubble of gas, and then having the patient position face down for several days, 2 or 3, 4 days, and that allows that bubble to push the hole closed and allows it to heal and form a bond between the edges of the hole. Macular hole surgery is successful in over 90% of cases. Vision is typically improved, but usually not to perfect. Most patients who have had macular hole surgery continue to see small defects in their vision, distortion in lines, perhaps a letter drop out in a word, but it's better than before surgery. The risks include retinal detachment, bleeding, and a very remote risk of infection. In general, 99% of the time, surgeries are without complication, and surgeries are associated with complications approximately 1% of the time. Patients who have their natural lens will generally have progression of cataract after macular hole surgery. Patients who've already had cataracts removed don't have that problem. So in general, macular hole surgery is a successful treatment for a problem that causes painless central visual loss. If you have further questions about the process and the disease, I would ask you to consult the information document on this website.